Good evening. I am Dr. Vijay Arora. I am a surgeon at Sir Gangaram Hospital. I am the head of the Department of General and Laparoscopic Surgery. I also run a clinic which is called the colorectal clinic. Colon and rectum are the parts of our body related to passing stool. The commonest problem that patients come to me with related to these is constipation. I am going to talk to you today about constipation. Everyone has felt constipated once in a lifetime. But when it is a temporary phenomena, when one day or 2 days after fasting or after other reasons of some ailment like fever, you are constipated, that will get relieved when you come to normal lifestyle. But when constipation is persistent, then most patients come and say, I have constipation. It is probably because of piles. Or they may be having painful defecation. That means pain when they are passing stool. And that may be the cause of constipation. So constipation with or without pain needs to have evaluation. It is not all right to take over-the-counter treatment that I had isbogol, I had Harad, I had any other medication that somebody prescribes. When you have a chronic constipation, particularly if you have pain or you need to strain to pass stool, then you must have a colorectal examination conducted on you. Without examining your area of the passage where the stool comes out from, the diagnosis of piles or other associated causes cannot be made. Sometimes tests are also conducted, but the first examination is a clinical examination, which you must undergo. Most of the patients feel, I have piles, and the piles are either bleeding, not bleeding, painful, not painful. But when we examine a patient, find that there may be many diseases in that area. You may be having a cut in the margin of the anal canal, which is the passage. It is possibly fissure. Or you may actually be having piles. Sometimes the reason may be more sinister and dangerous. You may be having cancer. Without examination, you tend to take certain medications without knowing whether or not they are right for you. For constipation, today you are told there are many medications available over the counter. Take this and your constipation is gone. But if it is not gone, then it is imperative, it is necessary that you have an examination done. One of the reasons for constipation in females particularly is that after childbirth or even just with aging, the area of the anal canal, which is the passage for stool, becomes tight or starts to protrude out, which we call prolapse. When you have a prolapse, it may not be visible to your eye. It may be only inside and can only be diagnosed by some investigation. I get patients who come to me and say, I have constipation, I have seen my surgeon, and he says you don't have piles, I don't know why constipation is not going. That is where specialized X-ray and MRI tests are done and we can come to a diagnosis. My suggestion to you today is, do not ignore constipation or what you call piles. Have it evaluated, have it screened as well as investigated. Come to a diagnosis and get the treatment. Thank you.